Hi, my name's Rick. I'm dad to three boys. Got Jake, who's 15, Ethan and Isaac, who are identical twins, who are 10. And Isaac has quite complex additional needs. He has quadriplegic cerebral palsy, he has tracheostomy, gastrostomy, peg fed. I don't want to define him by his disabilities, but he has got quite a complex set of disabilities and requires an awful lot of extra supportive care. Pandemic's affected Isaac enormously. Isaac's had long periods of being shielded. He's had long periods out of school. All right, an awful lot of children have had, but Isaac's has been more prolonged than others because certainly with regards to his return to school, that was affected by the school's ability to ensure sort of safe PPE practice around his tracheostomy and the suctioning around that and some of the complexities. He's also experienced obviously an awful lot of isolation from his friends. Isaac's a really sociable little guy and really has a close set of friends within his class at school. He attends a mainstream school, so he gets an awful lot out of the socialisation with other able-bodied children, but he's been completely isolated from that, and he's been unable to go out as part of a family or in any way really for the last sort of 16 months. I can't begin to kind of really emphasise how much it's affected Isaac, because I think it's affected everybody else. Everybody watching this will have been affected massively, but I suppose Isaac has experienced it at the more extreme end. The pandemic's affected the wider family, of course it has. I think the isolation for us as a family has been enormous. The very little opportunities that we did have to spend as a family out and about are no longer there. Possibly the biggest impact is that Isaac, we only recently, within the last couple of years, started to receive some extra short break support and respite support from a local hospice. That had to end at the beginning of the lockdowns, so we have gone 16 months essentially with no short break support. The impact of that on my wife and I's mental health, our physical health, because it's an awful lot of manual transferring of Isaac, and it's like most 10-year-olds, he's 30 odd kilos, and quite a physical toll, and the effect of that on his brothers. We can't do things as a family. We as parents can't afford the time with them, with his two brothers, that we would like to. Certainly not over this last 16 months, because in an ideal world Isaac could be 1/3 of our caring and parenting time, but the reality is that because of his level of needs, he'll never be that. It's been pretty impossible to be the carer, the case manager, the dad, the social worker, the husband, the main supporter of anybody who needs anything, and work full time over this last 16 months, and frankly not to give up, but you haven't got the option to give up. But I guess we were not coming from a position of everything being culpable and doable in the time prior to lockdowns, so it has just made it more pronounced. Certainly one of the things that we've had big impacts as a result of the pandemic around has been that there's been massive delays in relation to provision of equipment. So back in January 2020, we were approved for an extra hoisting point to be fitted within the house to help us with to help us with transfers of Isaac from his chair onto a cushion and into different pieces of equipment. As soon as lockdown started, that was put on the back burner, and as a result of that, we're still sat here now in July 2021 without that provision being in place. Over the last 10 years of Isaac's life, we're used to things being a challenge, but that has been You know, the delay upon further delays has been very, very difficult. Now, Isaac's been waiting now for getting on for a year for a new wheelchair. The predominant source of that delay has been because of the pandemic, that they weren't doing fittings and he needs a moulded seat. The seat was eventually moulded, but because the wheelchair provider is commissioned in by an NHS trust and a CCG, it's basically run as a business, and they will only provide, you know, one clinic per month that they will send a member of staff to fit these wheelchairs. We were informed yesterday that, you know, oh sorry, you know, Isaac's appointment this month with the wheelchair service and the particular provider has been cancelled because the provider's got somebody off sick. So essentially I will be added to the list for the next month. When you're facing, you know, Isaac doesn't want a new wheelchair, he needs a new wheelchair, because his current one is making him really, really uncomfortable. Why should we be caught in the market economics of a provider situation? Why should a child be subjected to a longer period of discomfort? These are things that are not unique to anything to do with a pandemic. This is the nature of provision of and that's just one. You know, I'm giving you that one from yesterday. I could give you 6 more from last year. You know, it's unfortunately this is how it is for families like ours. Even before the pandemic, it was really, really difficult to get the right services in place. You know, I can't stress enough to anybody who doesn't know or hasn't experienced it, that when you've got a child with complex medical needs and complex disabilities, you are quickly thrust into a world where you are the you're the hub of a big hub and spoke model of different professionals that are involved with your child. I could probably get into the dozens of different professionals that have been involved with Isaac over the last 10 years, from potentially well in excess of 20, 30 different agencies and organisations. There's no sharing of information hardly between those organisations, even between different hospital trusts. There's no sharing of information necessarily. Now, the knock-on effects of that upon a child and a family is that you spend an awful lot of time running around trying to sort things out and being that case manager. When you talk about improvements, people see that in terms of pound signs and think that it's going to cost money. But for me, some of the biggest improvements I've seen have been things that have been relatively cost neutral, but are changes that have been driven by people that have their hearts and minds engaged with addressing the needs of children like Isaac and families like mine. Organisational compassion and funding that will support organisations having that compassion. By showing that compassion, it won't endanger their funding in some other aspect of their provision. It is what's really needed to make change happen. A proper package of care around children and families like mine. You've got to be medium to long-term sighted on it. You know, Isaac has hopefully got many, many, many more decades of his life, and within that time, he and us, for the time that we've been on this planet, will require quite expensive services. So why not get it right? But you know, I think it's quite trite sometimes just to say it's about funding. It's not. It's about hearts and minds as well.